Today, I would like to welcome and respect all the viewers here in this video. This is the Health Talk Show, and this Health Talk Show is sponsored by EBC Co Ltd. EBC Co Ltd is the company in the field of treating the disease and maintaining health. And we have experience over 20 years. We have enough health knowledge and full range of product. So these three factors, we cannot miss one or two. We must have three all together. So if you are willing to treat your chronic disease to be well, you must find the company with these three factors. Our company has three factors. So if you want to contact us, we have a telephone here, and this telephone are all having a telegram. We have the address in the house 266 Street 150 Sangkat Teklo 2 Kantulko, Phnom Penh, Cambodia, Phnom Penh City, Cambodia. And this talk show is intended to give the knowledge of health, because the knowledge of health is also very important for the patient. The patient or the relative of the patient must have the knowledge of health. Otherwise, you can choose the wrong place, the wrong company to cure your illness or to treat your illness. So now our company have a channel called EBC Punlu Sokapip. EBC Punlu Sokapip is the channel that give or provide the knowledge of health. So you can watch all the video in this channel, and after you watch it, then you can subscribe and please share. And we have page also, EBC Punlu Sokapip. Page and YouTube are the same. We have the same name. Yeah, EBC Punlu Sokapip, YouTube and also page. And my Facebook is Pang Yun, and telephone is there. Okay, now we have a subject to talk about today is diabetes. Yeah, you already know the word or the name of the disease called diabetes. You already know, but sometimes you do not know in detail about this kind of disease. So now you can watch this video. I'm going to try to explain to you in detail. So what is diabetes? Diabetes is the disease showing high glucose in the urine. The urine with too much sweetness because of high sugar in the blood. Whenever the sugar increases too high in the blood, the densities of the sugar will absorb fluid from the muscle to the blood to drain out the sugar to the kidney and flowing out of the body. The urine has too much sugar, which is called diabetes. So you can understand here. So diabetes is the disease showing too much sugar in the urine. Too much sugar in urine. But why we have too much sugar in urine? Because the sugar rise up, or the sugar increase a lot in the blood. So whenever we have too much sugar in the blood, then the density of the sugar will absorb the fluid to drain out those sugar to the kidney and then flow the body. This is the mechanism of the body doing whenever you have too much sugar in the blood. So when the sugar flow into the urine out of the body, so in the urine there is a lot of sugar. When we have a lot of sugar in the urine, we have a disease called diabetes. So diabetes is like that. Yes. This is the what we call the condition of diabetes. Yeah, whenever you can understand here in English, I try to explain in English. We have in English and we have in Cambodian language. Yeah, but in English I have never done it. Now I try to do it for the person who cannot understand Cambodian or Khmer language, so they can see in English. Yeah. Here in this picture, you can see here, this person has diabetes. When she has diabetes, it means that in urine, in the urine, there's a lot of glucose or a lot of sugar. And you can look at this vein, blood vein. Here, one of the blood vein has less sugar, and the other blood vein has too much sugar in the blood. So when we have too much sugar in the blood, the sugar will flow into the kidney, then pass out of the body, yeah, to the urine. So in the urine, too much sugar. This is called diabetes. Yeah. You can look at the glucose in the blood. Yeah, you can look at the glucose in the blood. What will happen to the person with diabetes? How much glucose in their blood? Here you can see the chart showing milligram per deciliter, and this is normal person. This is impaired glucose. This is diabetic. Fasting, normal person. Whenever you check the blood in the morning with empty stomach, no eating, so then you will see your normal blood glucose is from 80 to 100 milligram per deciliter, and after eating around 30 minutes, sometime you can check again. Then the glucose will increase to from 170 to 200. So after 2 to 3 hours, then the glucose will drop down to 120 to 140. This is normal for the people without diabetes, or the person has a healthy glucose in the blood. But here, yeah, in the middle column here, in the middle row, then you can see that impaired glucose. It means that the glucose is right up a little bit. So in the morning with your empty stomach, then the glucose will show from 101 to 125. It means that you are now have a higher glucose in the blood, but it doesn't come into the diabetes yet. It just have a higher glucose in the blood. This is what we call pre-diabetic. So after eating, then your glucose, after eating around 30 minutes, then your glucose will come to from 190 to 230. This is like what we call pre-diabetic. And after 2 to 3 hours of eating, then your glucose will become 140 to 160. This is what we call pre-diabetic or impaired glucose. It means that glucose is higher than normal. So you have to be careful when you check your blood in the morning, and then it show this range of glucose in the blood. But for diabetic, whenever you check in the morning, then your glucose will come to 126 over or plus. Yeah, then this is what we say that you are now in diabetic condition. But after eating 30 minutes, then your glucose will come up to 220 to 300. This is diabetic, and from 2 to 3 hours of eating, then 200 plus. It means that you are now in a diabetic condition. Yeah. So here's 3 charts: normal person without with healthy glucose in blood, and this is impaired glucose. This is diabetic. So you can see this chart. and everybody should check your blood in the morning. Yeah, especially when you are at the age of 35 to 40, you have to check it. Yeah, you check it like 3 months once, or 5 months, or 6 or 4 months once. Yeah, you have to check it. The symptom of diabetic. Yeah, symptom of diabetic. Yeah, sometimes the people do not know they are having diabetic. Sometimes they don't know because they never check their blood. They are lazy or they don't care, and then they have already diabetic. The glucose rise very high in their blood. Yeah, so they will have a symptom like this. Symptom like increased thirst. You are very thirsty. You drink a lot of water every day. Yeah, and drink again and again. And you increase hunger. You increase hunger. You mean that you cannot cope up your hunger. Yeah, whenever you feel hungry, then you are like what we say that severely hungry. Yeah. So this is a symptom, the symptom that you have to notice. And another symptom is you lose weight, and lose weight very fast, and unexplained lose weight. Yeah, you don't know what reason that you lose weight. This is a way that we have a symptom of diabetes. And the symptom is fatigue, feeling tired, and lacking energy. Yeah, lacking energy. You are always feeling tired. Yeah, fatigue, no energy, just like want to relax, want to sleep, inactive sometimes. You're feeling lazy, something like that. And you need to eat something then to energize your body. Yeah, if you don't do that, then your body is shaking, like shaking. This is a way that we show that you are having diabetes. Frequent urination and too much urine. Yeah, when you get diabetic, then you urinate very frequently. Yeah, and one time your urine is too much. Your urine is too much. You urinate frequently and your urine is too much. You urine one time is like 500 or maybe 1 liter of urine, something like that, and you get lose very fast. You get lose weight very fast, and you feel hungry, you feel tired. Yeah, and you feel like very thirsty, something like that, And another one of the symptom is blurry vision. You cannot see clearly, You have blur vision. You cannot see clearly. Yeah, when you get diabetes, then your eyes are like that. Yeah, tingling and numbness in hands and feet. You feel like a tingle in the feet. You feel numbness. You feel poking, and sometimes you feel hot in your palm of the foot. Something like that. Okay, now you already understand the symptom of diabetic. Yeah, the diabetic have a symptom like that, so you can notice whether you are diabetic or not. You will have this symptom, but this symptom cannot or will not show exactly you have diabetic or not. But most of the diabetic person have this symptom. So if you want to know clearly, you have to check the blood in the morning. Okay, now the condition of diabetes. Yeah. Okay, how diabetes happen? Yeah, I explain in detail to you. Normally we have already glucose in our blood, and this glucose is added more every day by our 3 to 4 times meal, especially meal with high carbohydrate like rice or other sweet fruit. You understand? In fact, the person has glucose already in the blood. Yeah, everybody have glucose. If you don't have glucose, how you can live? Yeah, because you eat every day, so the glucose is there in the blood every day. Yeah, but this glucose is added more and more every day too, because you eat 3 to 4 times per day, and your meal usually with high carbohydrate or sweet fruit. So these kind of carbohydrate and sweet, yeah, and sweetness will add up to your glucose in the blood. So the glucose will rise up. The extra glucose is transported from the blood vein into the muscle and other cell for combustion, for energy. The agent that help bring glucose to the insulin, that bring glucose is the insulin secreted by the pancreas. If the insulin is not enough, the more glucose is still in the blood. This is why the glucose increases step by step in the blood without the patient's knowledge. This is called high glucose in the blood or high sugar in the blood. So this is the way that the diabetes happen in your body. So okay, you understand this? Yeah, you understand this or not? I explain you again. Okay, the person nowadays everybody have glucose in the blood already, but the glucose will add up more and more every day because of you eating meals, and your meal mostly have carbohydrate, or the sweetness of the fruit that you eat. Yeah, but you know, when the glucose rise up in the blood, the glucose will be transported to the blood, to the muscle cell and liver cell and fat cell for combustion, to burn as energy. We have energy because we have glucose in the blood, and the glucose is transported to be burned in the muscle for energy. So we have why we have energy? Because of the glucose. Because of the glucose that we eat the food. Yeah. But we wonder who bring the glucose to be burned in the cell, like muscle cell or liver cell or fat cell. Yeah, who bring? Yeah, the agent that bring glucose from the blood vein to the muscle cell, to the liver cell, to the fat cell is the insulin secreted by the pancreas. So the pancreas secrete the insulin to bring glucose. So glucose cannot go into the muscle by itself. Cannot. Yeah, if we don't have the insulin to take it in, to bring it in. Yeah, but whenever the insulin is not enough, it means that the pancreas does not secrete the insulin enough. Then the glucose cannot go. Yeah, the example glucose need 100 insulin, but now the insulin is only 50. So the insulin can bring only 50 glucose to the muscle cell, to the liver cell, or to the fat cells. Then the other glucose is still in the blood. So when this process is disturbed like that, then the glucose will rise up again and again, step by step, in the blood vein until the glucose very high in the blood. Then we have problem already. We have problem already. This is a way that our body do. Yeah, so the diabetes is the problem of the insulin is not enough. The problem of insulin is not enough. Insulin is not enough because of the pancreas doesn't work well. Yeah, this is a way that I try to explain to you clearly. So here you can see the picture here. You can see. So here is the blood vein, and here the pancreas and the stomach. You know, whenever the stomach release the carbohydrate into the blood vein, and then the pancreas release insulin, secrete insulin into the blood vein too, in order to bring glucose from the blood vein to the muscle to be burned for energy. This is a way. Yeah. But the problem is the insulin is not enough. This is a problem of the person with diabetes. Okay, now you can explain more. You can see more. If the high sugar in blood is not reduced, is the high sugar or high glucose in the blood is not reduced, it will increase gradually till too much. Example, 400 to 500 milligram per deciliter. The density of the glucose will absorb the fluid to drain out into the kidney and flowing out the body. This glucose in the urine is called diabetes. So diabetes is like that. Diabetes is like that. So you can understand that whenever the sugar in the blood is not reduced, then it will increase again and again. You know, when it will increase to the peak amount, example 400 to 500 or over, then the density of the glucose will absorb the fluid. This is the body do. The body do. Yeah, the body do. Our body do. Like that. Yeah. Then it will absorb the water or the fluid from the muscle, from every part of the body into the blood vein to drain out the glucose into the kidney. Why the body do that? Our body is very clever. Very clever. If our body don't do that, you will die, because everything will stuck, like the blood will not moving anymore, or the heart will not working. It will stop. So you die already. But before you die, our body can do for us like that. Yeah, you can survive, or you can have time to go to the hospital to be treated. Yeah, the body is our clever, before we die. Okay, the density of the glucose will absorb the fluid to drain out into the kidney and flowing out the body. This glucose in urine is called diabetes. Yeah. So diabetes, your urine has a lot of sugar. Yeah, have a lot of sugar or glucose. Whenever you urinate anywhere, then the ants will go there to eat all those urine. Yeah. So in the local countryside, the person do not have the knowledge. The people mostly do not have the knowledge of the diabetes, so they don't know they are having diabetes. Yeah, they are living with diabetes for so long, and then they urinate somewhere, and then the ants will go there to eat the sugar in the urine. So at that time they notice that, oh, why my urine are very sweet? Yeah, because the ant going there to eat. Then they will know, oh, I have diabetes already. Yeah, the people like that, they will check the blood in the hospital. Okay, if you can understand already, then please share, subscribe and share. Yeah. The exact cause of diabetes. Now you understand about the exact cause of diabetes. Diabetes is very complicated disease which concerns a lot of system organs in the body. However, medical scientists found out that the increased glucose in blood is caused by two reasons. One, not enough insulin by the pancreas, 2 muscle fat, liver cell, muscle fat and liver cell resist insulin. So this is 2 reasons that that the person have diabetes. Have diabetes. Okay, 1. Okay, now diabetes happen because of 2 reasons. So 1 reason is not enough insulin by weak pancreas. The pancreas is the organ whose function are to secrete digestive enzyme to dissolve food in the small intestine and to secrete insulin to balance glucose in the blood. A group of cells in the pancreas called islet of Langerhans, especially beta cell and alpha cell, have their function to secrete insulin and glucagon to balance glucose in the blood. These cells start to be weakened step by step. If they are so weak, they will not be able to produce enough insulin. Then the glucose will increase automatically and the patient needs urgent care to be injected with insulin from outside for survival. Okay, now you can understand. Okay, I explained you, but you can understand here. Diabetes happen because of 1, not enough insulin by the weak pancreas. As I already explained to you again and again, the glucose rise up or increase too much in the blood vein because the insulin is not enough. Because insulin is the hormone. Insulin is the hormone secreted by the pancreas. Insulin is the hormone that brings the glucose from the blood vein to the muscle cell, to the liver cell and fat cell. The glucose cannot go alone, cannot go by itself. It must have somebody to bring him to the cell, to the muscle cell, to be burned for energy. But who bring the glucose? The scientists found that the insulin, the hormone insulin, bring the glucose. Now the problem is the insulin is not enough. And why the insulin is not enough? Because of the pancreas. Because of the pancreas. And the pancreas is an organ. They have 2 functions. One function is to secrete enzyme, digestive enzyme, in order to dissolve the food. And another function is to secrete insulin and glucagon to balance the sugar in the blood. The problem now, the pancreas is not working well. And inside the pancreas, there is a group of cell called islet of Langerhans. And in that group, there are 2 cells called beta cell and alpha cell. These 2 cells are very important to secrete insulin and glucagon to balance the glucose. Now, these 2 cells are not working well. These 2 cells are now sick. They cannot work well to secrete the insulin and glucagon. So whenever they cannot produce enough insulin, then how can they bring the glucose from the blood to the muscle cell, to the fat cell, to the liver cell for burning as energy? They cannot. So the glucose still in the blood. And by adding the glucose every day from our food, the glucose will rise up again and again and again until too much glucose. Until too much glucose in the body, in the blood vein. So the person will be in the trouble, like not well in the body, faint, or heart working too much, beating too much, something like that. Then this person cannot live happily again, they have to go to hospital. So the doctor will check the blood, and then they see that, oh, glucose are very high. So in an emergency case, they must inject the insulin from outside the body, the artificial insulin from outside the body, in order to reduce the glucose. If they don't do that, then the person can be dead. Yeah, this is a way that they help the patient to survive. Yeah, from the diabetes, from a high a very high blood sugar in the blood. Yeah, very high blood sugar. So this is a way. Yeah. Now we ask the question, why we don't have enough insulin? The answer, we don't have enough insulin because the pancreas is not working well. Why the pancreas not working well? Because the cell, beta cell and the alpha cell doesn't work well, do not work well. So when they do not work well, how they secrete the insulin enough? Cannot. So what you have to do is to help beta cell and alpha cell to work well again. This is the way that you have to do. You can see here, this is a pancreas. So in the pancreas, there's a group of cell called islet of Langerhans or pancreas islet here, this group, alpha cell and beta cell. Yeah, and these cells produce insulin, and the insulin directly go to the blood vein, not go to the intestine. No, yeah, because this kind of cell produce insulin, and then insulin direct to the blood vein. Yeah, in order to balance the sugar. So you can look at here the picture. I'll show you. Islet of Langerhans. Yeah, and islet of Langerhans, in this group there are a lot of cells, but the two main cells that are very important is called alpha cell and beta cell. Alpha cell and beta cell. Sorry. Yeah, called alpha cell and beta cell, like here. This is the alpha cell. They secrete glucagon. This is beta cell, secrete insulin. So these two insulins not working well. So what you have to do is to help these two cells to work well again. Now number 2. Cell resist insulin. Muscle, fat, and liver cell. As you already know that the high blood sugar happen because of two reasons. One is not enough insulin because of the pancreas not working well. When we say the pancreas not working well, we say it means that beta cell and alpha cell do not work well. So number 2, sometimes it doesn't have any problem with the insulin. The insulin is enough, but the problem is the cells, like muscle cell, fat cell, liver cell, resist insulin. This is another problem that the scientists found out about the diabetes. So here you can read here, the reason why glucose increases in blood is also caused by muscle, fat, and liver cell starting to resist insulin. Naturally, these cells must recognize and allow insulin to bring glucose to be burned in the muscle for energy. But now they don't recognize and allow anymore. This is called metabolic disorder diabetes. The question is, why the muscle fat and liver cell muscle fat and liver cell do not recognize and allow insulin to fulfill their function? The answer is that they start to be error, to be abnormally functioning, mean these cells are not properly supplemented with good nutrient and some other force from outside, like chemical and polluted environment. Okay, so this is number 2. that it doesn't concern with the insulin. Yeah, it's not concerned with the insulin, but it concerned with the cell, the cell of the muscle, the cell of the fat, and the cell of the liver resist the insulin. Do not recognize the insulin to bring the glucose into the muscle again, into the fat cell again, into the liver again. So this is a problem. Naturally, this cell recognize and allow insulin to bring glucose. But now it doesn't recognize. They do not recognize anymore. They do not allow anymore. Yeah, this is a problem. This is a problem of the diabetes too. The scientists found out this one too. And the question why the muscle cell, fat cell, and liver cell do not fulfill their function, do not do their function anymore? The answer is they start to be error. They don't work well again. They start to be error. And why they start to be error? Because the cell, even the muscle cell, fat cell, liver cell, or any cell in the body, they are alive. They have life. So they can be error, they can be sick, they can be strong, they can be well. Yeah, they can do that like that. Yeah, because they have a life. So now they start to be error. They start to be weak. They start to be sick. Yeah, so they cannot complete their role, complete their function again. This is what happened to the cell. And the question why they cannot complete their function, they start to be error, because they don't have any education. Like we don't have any education for our children. Look like that. Yeah, the same like that. And the cell need to be educated too. And how to educate the cell? To supplement the cell, because the cell need the good supplement, need the good food, and you don't give the good food to them. So how can they live? How can they be strong? How can they be working well? This is a way that you have to understand. So now you must focus on helping the cell, the fat cell, the muscle cell, or the liver cell, or the pancreas cell, like a beta cell and liver cell again. So this is a matter of the cell. If you don't take care of the cell, then the problem will happen. The problem will happen. Any kind of problem can happen. So in this case, yeah, the cell start to resist the insulin. They start to resist the insulin. This is what we call the metabolic disorder diabetes. The diabetes happen because of the metabolic disorder. Yeah. So here you can look at the picture. You can look at the picture here. Insulin resistant cell. This is liver. This is muscle. This is fat. So usually the insulin is look like a key that unlock and then bring the glucose into the cell. But now this key cannot lock and again, cannot unlock. Yeah, cannot unlock. This key again cannot unlock. Yeah, they close. They do not recognize the insulin. This is a problem. So the problem is the cell that has become error. They cannot bring the glucose into the cell. So how can the cell survive? How can the cell become strong? Cannot become strong. Yeah. So the problem is the cell. Yeah, the cells. Okay. Now you can hear already. You can see already. The diabetes happen because of one is not enough insulin, because the pancreas is weak. We can say that, or we can say the group of the cell, especially beta cell or alpha cell, are weak. When we say that, it means the pancreas are weak. Yes, So the same meaning. And another one is cell start to resist. Yeah, muscle cell, fat cell, liver cell start to resist the insulin. Insulin cannot go into the cell. Yeah, cannot unlock the cell. So then the sugar will start up. Yeah, will increase again and again in the blood vein. So now how to treat diabetes properly? Yeah. Now you look at the guideline. To treat diabetes properly, 1, must take medicine every day. Number 2, must take good food supplement. Number 3, limit food intake every day. Number 4, must do exercise every day. Number 5, must have good well-being. Okay, look at number 1. Whenever you have high glucose in the blood, or whenever you have diabetes, you must take medicine every day. You cannot miss one or another day. You must take every day and every time. Example, you take in the morning at 7 o'clock, then tomorrow you have to take at 7 o'clock in the morning the same. You cannot take at 7, take at 8 or at 9 o'clock. No, you cannot. You must take regularly medicine in order to reduce the glucose in the blood. Yeah, if you don't do that, the glucose will come up. Yeah, this is a way that you treat diabetes. You have to take every day without stopping, without missing any single day, and you have to stick at the regular time. Number 2, yeah, but to take a medicine is not to like what we call to suppress the symptom or to maintain the sugar level in the blood, something like that. It doesn't do any more further than this. Yeah, to the to the pancreas or to the cell. No, the medicine is look like insulin, look like insulin, and some kind of medicine just do their work like pushing the pancreas, secreting too much insulin, or maybe some kind of medicine is just like stopping the sugar from the intestine, or stopping the livers releasing too much sugar, something like that. Yes, it doesn't cure the root cause of the problem, but you have to take the medicine every day, because medicine is just like a emergency case. It look like that, the medicine. So the medicine from your doctor of diabetes you have to take. But another number 2 that you have to take it, without missing is you take the food supplement. As I already explained to you, the diabetes happen because of 2 reasons. One is a weak pancreas that cannot produce enough insulin. This is one. Another one is diabetic because of metabolic disorder. It means that the cell doesn't complete their role, doesn't fulfill their role. So even it happened because of the weak pancreas, or it happened because of metabolic disorder, but they are all the cell's problem. So the cell, I already explained to you that the cell have life. So when they have life, they need food, they need good food, they need good nutrient. So whenever you want to settle the diabetes, you must give the good food to the cell, even the pancreas cell or metabolic cell. You must give cell to them. Your good food to all those cells. If you don't give the good food to all those cells, you give only the medicine, then sooner or later you cannot maintain your blood sugar. You cannot, because the pancreas will be weaker and weaker step by step. Then it will weak. It will be too weak. When it will be too weak, then there is no insulin. So you have to be injected with insulin forever in your life. Yeah, and if you, like example, your diabetic happen because of metabolic disorder, it means that the cell resists the insulin. So whenever you don't help those cells back to normal, then you know the cell do not work well, do not complete their, or do not fulfill their function. So the sugar will rise up again and again and again, and you also have to be injected with the insulin from outside again, the same. So now to settle the problem properly, you must give the food, the good food. The good food, whenever you are waiting for the good food from your food, the good nutrient from your food, cannot, because you cannot eat anything like having a lot of nutrient. You cannot. You can eat normally as you want, but you must use the product, because the product they already conducted, or they already made with a lot of nutrient inside. Like here, my experience, I treat a lot of diabetes patient. I use this spirulina maca. There has a lot of nutrient inside, around 60 nutrient, and you have to use Easter C is a very essential form of vitamin C, and chlorophyll. So these three products, you have to take it with your food, with your medicine. This is a way that we help yourself. Help all those cells inside the body. Not even the pancreas, not even the muscle cell, fat cell, or liver cell, but all the cell inside the body. Yeah. And another new way to activate the cell to be strong again, then we have like a device to blow on the pancreas and to blow on the body. This kind of the device, you blow on the cell, you blow on the body, then one, it will activate all the cell that are weak, it will become strong again, it will work again. And another function of the device is to hit the body in order to open the small blood, so that the blood can move well or go well inside the body. So this is a way that we do with the device. So now if you want to treat your diabetes in a proper way, one, you have to go good food like this product, and another one, you have to use the device too. Yeah, this is a modern technology. This is a product. The product that I show you, spirulina maca. Spirulina maca is Japanese food supplement containing essential 65 nutrients, internationally recognized by many organizations and associations. The nutrient meet the requirement of the body cell. Here you can see the mineral, 20 mineral, 18 vitamin, 18 protein, 100 alkaline, 400 pigment, 4 natural pigment, natural carbohydrate, natural fat. So spirulina maca is enough for diabetes person. Because a lot of nutrient inside, and this is natural food. Okay, number three, for diabetic patient, you have to limit your food intake. You cannot eat anything you want. No, you limit your food with high carbohydrate, because whenever you eat a lot of carbohydrate, you will have a high glucose, high sugar in your blood. So when you have high glucose in the blood, it will be a burden for the pancreas to produce more insulin. to produce more insulin. Now the pancreas is what we can say sick. The pancreas is now sick. Yeah. So whenever you force your pancreas to produce more insulin, why the pancreas is sick, then the pancreas will be more weaker and weaker. This is the problem. That's why you limit your food with carbohydrate. You don't eat a lot of carbohydrate. You increase vegetable food, eat at the regular time, cut down or stop snack. For diabetic person, you cannot eat every time. You cannot have a sweet mouth. No, cannot. You can eat only meal, and at regular time. Don't eat up to your hunger. Yeah, sometimes I'm very hungry, so I have to eat a lot. Now I'm not hungry, so I don't eat a lot. No. You don't do like that. You eat at you limit your food, increase veggie, eat at regular time, cut down or stop snack. Don't eat up to your hunger. So this is the way that you have to do. And number 4, you have to do exercise every day. Yeah, for diabetes, you have to do exercise in order to help your body strong, to sweat, to burn the fat, to burn calorie inside your body. So this is a way that to be healthy with diabetes. Diabetes, you are not lazy. You cannot be lazy when you get diabetes. You have to do exercise. So we can say that diabetic person must not be a lazy person. We can say that, because they have to do many things like exercise, and you must have good well-being. Your spirit must be well. Good well-being. You must happy. You don't feel disappointed. You don't feel alone. You don't feel lonely. You don't feel like unhappiness or sad all the time. No. Diabetic, you must keep your feeling happy, enthusiastic, and joyful, so you can live at a healthy life. Yeah, if you can do that. So here I repeat again. For diabetic person, you must take medicine every day, and you must take the food supplement with the good nutrient like spirulina maca, Easter seed, and chlorophyll liquid. And now modern technology to help the cell to be activated, you must use the device with terahertz technology. And here is the product with a lot of nutrients, spirulina maca, suitable for diabetes. Especially they have nutrient from mineral like chromium, like manganese. This is good for pancreas. Yeah, and you limit your food intake every day. You have to do exercise, and you must have good well-being to be happy in your life. So this is 5 ways for diabetic person do. And if you can now, okay, you already understand why we have diabetic, what is the cause of diabetic. So you can see the video again and again, and please subscribe and share. And this is telephone number. If you are if you don't understand, or you want to be clear more, you can contact me by this telephone number, or you can comment in the video. And I would like to say, like, okay, sorry for my English, because I haven't spoken English for so long. I only read, so the speaking is not so well, and sometimes speaking is in the wrong way. But anyway, I'm trying to explain, I'm trying to explain you again and again. Yeah, and I'm doing video English. Please subscribe and share this video, and see you another subject and another video next.